Welcome back to Your Mouth Matters, the podcast where the mouth meets medicine. I am Dr. Rebecca Taylor, here with my co-host, Dr. Isabel Perez. Today's episode is for naturopaths, functional medicine doctors, and integrative practitioners who want to offer true comprehensive care, because if we ignore the mouth, we're missing a critical piece of the healing puzzle. We'll explore how oral health impacts gut function, hormones, detox, brain health, and the immune system. You'll learn why hidden dental infections, gum disease, mercury fillings, and non-biocompatible materials can quietly sabotage your patient's progress and what to do about it. We'll also share how biological dentistry uses tools like CBCT, ozone, safe mercury removal, and energy-aware approaches to uncover root causes that standard dentistry often misses. If you're ready to deepen your impact and work more collaboratively, for better patient outcomes, this episode is for you. Let's dive in. Welcome, Dr. Isabel.
Hello.
So glad to have you back on.
Thank you so much for having me.
So today, Dr. Isabel and I, we work together and we see and work with a lot of patients. And we were kind of talking about what other kind of podcasts do we need to do. And one thing that really came up for both of us was that there are so many practitioners that we work with, or we have patients that come in and they have dental issues. And so many of the things that we see in the mouth are linked actually to other systemic underlying conditions. So, like, for example, if you have a bunch of cavities, we're always going to be focused on your gut health and maybe your nose breathing. So some of those things we can talk with them about patients, but a lot of times we actually recommend that patients go to their naturopath or their functional medicine doctor so that they can dig deeper, maybe do more testing and figure out really what is going on systemically. We really want to focus on treating the root cause. And what's really interesting is that a lot of naturopaths and functional medicine doctors that we have found really don't know a lot about the mouth, and sometimes they even call us, and I've had several conversations with naturopaths or functional medicine doctors, and they call me and say okay, so what do you want me to do? And I'm like, well, you're the doctor. So I think that there is this huge gap in education when it comes to naturopaths and functional medicine doctors. And I'm not speaking for all of them. We do work with several really, really great doctors that are very educated about the mouth. And I love working with them because they just really get it. But a lot of our patients come in already with a naturopath or a functional medicine doctor, and they don't want to change their doctor. They like their doctor. And so this podcast is really for your naturopath or your functional medicine doctor. And I hope that you share it with them, because this is going to help them become a better practitioner, honestly. I mean, it's impossible. I don't know how you treat the whole body and you forget about the mouth. It's just so much of our disease happens in the mouth, and there's so many links. So if you're a doctor listening to this, or you're a patient listening to this, this is all really, really great information, because we're going to kind of go over in not a ton of detail. We're going to go over kind of the main dental diseases, what we look for, and really how we can work together as a team, because your care really needs to be about integrating the different treatments so that you get the best clinical outcome, right? We want to help you with your symptoms, but we also want those symptoms to stay away, and we want to set you up for lifelong health. So today, let's go ahead and just dive in.
Yeah, one of the things I wanted to say before we start diving in is it's yes, definitely for any medical professional like naturopaths, functional medicine doctors, or even Western conventional doctors, because a lot of them don't really understand about how important it is, but also even for craniosacral, because they are a big part of what we do. It's necessary to go through craniosacral therapy, maybe even acupuncture. So all doctors should be knowledgeable about how the mouth can affect the rest of the body, because it's not just affecting the mouth, it's affecting the whole body.
Yeah.
And then when Dr. Taylor treats her patients with TMJ, it will be important for a physical therapist to know that what she's changing in the mouth can be affecting the rest of the body.
Yeah. Yeah, I think I'm just excited for this podcast because it's like, let's talk to you all so we can be on the same page. Because, yeah, I just think that, a lot of times patients come and they're just a little bit lost. They don't really know what to do. And, they hear something from us, but then they go off and then their doctor doesn't really know what to do and they just kind of get lost. So when we can work together with your practitioner and we can really be a team with them and they are speaking our language and we're speaking their language, it just works so much better. And then you're really well held during that whole healing process. So, okay, so there are a couple of main diseases in dentistry, and I think it's just important to highlight that just right off the bat because not everybody thinks maybe about dentistry or as having diseases, right? So the two big diseases that we deal with are cavities and periodontal disease. Okay. Cavities can lead to infections in the teeth, like abscesses. And then periodontal disease can also lead to infections in the gums, and that can really impact the stomach health as well. And then there's actually a third type of disease that we work with in the mouth, and that is actually called occlusal disease. And occlusal disease is a bite disease. It's a disorder of the biting surface, and that is one that we probably don't even really think about as a disease, but it can have huge impacts on a patient's symptoms and their total body health. A lot of neurological things can happen when you have a bite issue. And we can go into that more in a little bit detail. But I want, as the doctors and the patients listening, we got those two main diseases, cavities and periodontal disease. And then we've also got the occlusal disease. Okay. So let's talk about each of those so that we get a good summary and then we can, we can go into more depth as we need to. So one of Dr. Isabel's favorite things to talk about is like the teeth and the meridians. So why don't you talk about that a little bit, Dr. Isabel, just to kind of lay the foundation before we really jump in.
So when we are having an affection in the body, we are all energetic beings, and there's measurements that can be done about that energetic field that we all have. And that's why when we do an EKG, then we get some measurements. There's energy in there actually that is being read. When we get CBCT or when we get another imaging, it's just capturing the density and the energy that is in that area. But then when we're talking about teeth, we follow the meridians of the body just as an acupuncturist. Every single tooth is connected to a meridian in the body. That if one of them is having issues, one of the teeth is having issues, it will be important to look at that meridian and what kind of organ is connected to that meridian, because it could cause an imbalance on that organ. So the body, when we look at the chronic disease, for example, is an inability to make new cells, or there is an imbalance that is happening in the body. The body needs about 50 millivolts to regenerate tissue. And if there is a dental infection, if there is a cavity, or if there's other things that will go over that, like heavy metals, mercury filling, or if there's galvanic frequencies in the body, in the currents in the body, that is going to cause an imbalance in it. So it's going to be lowering those millivolts, reducing the possibility to regenerate the cells of the body. So then when we cannot make new cells, you cannot really heal. And when we talk about the cavities, the cavity can start as a very simple little stain, or even we won't be able to see it only with the x-rays. And there's different stages, as I mentioned. So the incipient cavities, there is a lot more things that we can do to remineralize that area and help and protect. And then if it gets into a more deeper layer on the tooth structure, we have to start thinking about doing restorations like a filling. Or if it gets even bigger, then we have to do a bigger restoration that can be only an inlay or a crown. So those are different layers. But then our goal is to try to catch those early, but not only catch them, also finding what is it that is causing that. And that's what we want to kind of have a really deep dive into it. Okay, if we see an issue, let's just don't fix that issue. Let's just go and find out why is it that this issue is even showing up in the mouth.
Mm-hmm. Yeah, so I think it's really fascinating to think about the teeth meridians, because you have to wonder, like, okay, if there are these different meridians to the body and each tooth is connected to a certain area and organ in our body, where did the disease process begin, right? Was it that is it because the tooth infection maybe is on that same meridian, maybe causing some of these other systemic issues? Or is there disease somewhere else in the body, in one of those organs, that is then translating up into the tooth? It's just really, really fascinating when you start to learn about biological dentistry and Chinese medicine. Your brain kind of gets blown, and it's really fun. So if you've actually had if you have a patient that's dealing with like a chronic thing and you're just like, I don't know why this person is not healing, this is really tough, go check out the meridian chart and ask them about dental x-rays, dental work, infections. A lot of patients are walking around with root canals that have abscesses, or they have infections in their head, or they have periodontal disease, and you might not even be aware of that. And that really could impact your treatment plan and the success that you're going to see with your patients. So let's start off by just talking about cavities. I think this is it's a great topic. Most people have had a cavity in their life, and it's very, very common, but it does not mean that it's normal. So remember, the enamel in our body is harder than any other surface in the body. It's super, super dense mineral made with hydroxyapatite, and it's in a crystal structure. And so when we start to see that enamel break down, we know, okay, there's a problem here. So our enamel is very, very hard, and when enamel breaks down, it's because the mouth is too acidic. So plaque will sit on the teeth that's acidic, and the plaque is from the bacteria that are in the mouth, okay? So the microbiome, the type of bacteria that are in the mouth, are really important, because those cavity bacteria are going to eat carbohydrates, okay? And they are going to poop out plaque, which is acid, and that is going to sit on the teeth. So yes, it is important that people are brushing and flossing. However, when it comes to cavities, I always talk to patients about their diet, because you cannot make plaque, you cannot make acidic plaque from fat and protein. So anytime that I see a patient with a lot of decay, I know that they're eating a high carbohydrate diet. And I don't care if it's fruit, I don't care if it's grains or bread, whatever. There's some kind of carbohydrate in there that is being converted into plaque that then sits on the tooth and is going to cause breakdown. Now, our system is very smart, and our teeth, we're made to eat food. And every time that we eat, our body or our saliva turns acidic. And so when our mouth becomes acidic, to dissolve enamel, we have to get up to 5.5 pH, which is pretty darn acidic, okay? But the underlayer of the tooth, or the root surface of the tooth, is only 6.5, okay? So you don't have to be that acidic in your mouth to start dissolving the mineral out, okay? But our bodies are super smart, because we have saliva, and our saliva has buffering agents inside of it, and it has mineral. So after you eat, the saliva is going to come in, and it's going to bathe the teeth, and it is going to buffer the acid, so it's going to take all that acid away, and it is going to put the mineral back into the teeth, okay? So it's important to know that throughout the day, your teeth are constantly losing mineral, and then the saliva comes in, and it's putting the mineral back in. So saliva is our best friend when it comes to cavities, okay? The other thing is the microbiome, okay? We can actually do a salivary test to tell if you have high amounts of cavity bacteria, and we actually do that on every single new patient that we see. So if we see high amounts of cavity bacteria, we know that the mouth is probably going to be more acidic. And how do we treat that? So we have to fix the microbiome. We also have to make sure that the saliva has all of the things, like all of the minerals, okay? So this is where it comes to the diet, right? We have to make sure that this patient is getting enough mineral. The other thing that really inhibits saliva is mouth breathing. A lot of people go around their life with their mouth hanging wide open. They might be breathing through their mouth, and so that is going to dry the mouth. If you're sleeping and your mouth is hanging open, or you're drooling, that's a sign your mouth is open. That's going to change the pH in your mouth, and that is going to cause you to be a higher risk for having decay. So we need patients to be nasal breathing. We need their mouths to be closed, and this will literally change the environment in their mouth to make sure that the good bacteria can stay, and it will set up a less acidic environment for the mouth. Isn't that crazy? Just by our breathing. So if we see a kid that's got big old tonsils and they can't hold their mouth closed, I'm going to be more aggressive as a dentist in saying, we got to figure out this tonsil issue, because I know that that's going to cause dysbiosis in the mouth, and then that kid is going to get cavities, right? So this is super important, because so many times I hear pediatricians come back and say, well, the tonsils aren't that big, they'll outgrow it. Like, yes, they're mouth breathing, but who cares? Well, we care, because this is literally why the kid is getting cavities. Okay, so we have to really think about this as a team together. And so as the doctor, as the naturopath, you're looking at minerals. Is their gut microbiome good enough to absorb all of those minerals and vitamins that we need? We're looking really heavily at fat-soluble vitamins. So vitamin A, vitamin D, vitamin K2, all super important in the tooth's ability to remineralize. And then we want to make sure, because this is all one tube, right? We have our microbiome starts in our nose and mouth, and then it goes down to the gut. So if we have dysbiosis here, we're swallowing all of that bacteria into the gut. And studies have shown that some of the oral pathogens, the nasty oral pathogens, actually make it all the way through the stomach acid and into the gut. So if we have dysbiosis here, we most definitely have dysbiosis in the gut as well. So if we clean up the mouth, but we don't clean up the gut, we've only cleaned half of the tube. So we have to make sure that the doctors that we're working with are really focused on getting the gut dysbiosis taken care of and getting that gut functional. That's going to help your patients so much when it comes to helping them treat the root cause of why we have cavities.
And another important thing is that if you are treating a patient, for example, that is having imbalances in their hormones, a lot of the times those patients, they get dry mouth. And as Dr. Taylor just mentioned, they can cause a lot of risk for cavities and periodontal disease. And the thing is that oral microbiome, the microbes will travel not only as you swallow, but they can also go to the bloodstream and contributing to inflammatory bowel disease, leaky gut, liver stress, cardiovascular and immune diseases. So it creates a kind of a chain reaction of conflict. So you can look at it both ways. If there is a problem in the mouth, let's look at what can be causing or what's happening in the body. Or if there is a problem in the body, how is that affecting the mouth? Because they are really, really connected. So that by treating the dysbiosis, for example, in the mouth, you are going to be helping this patient to avoid or to correct or improve all these other systemic conditions.
Yeah, it's pretty wild. All these oral systemic connections, super fun. So when we have a kid that has a filling or a person that comes in that has a lot of cavities, we also want to make sure we rule out any kind of celiac disease or any kind of chronic gut inflammatory disease that we might have going on. Those tend to be very common, especially when we see really, really aggressive cavities. The other thing I've also noticed is that patients that have high stress, they also are at super, super high risk for cavities. So we can do things on our end to help prevent these things. We can make remineralization trays. We can have them doing hydroxyapatite. We can have them brushing and flossing and doing all of these things. But we have to also work on getting their stress down, which I know is one of the hardest things to do with some patients because sometimes it's really out of our control. But we need to make sure that we're supporting those patients that are going through all of that stress. They need more mineral. They need more magnesium because their body's just burning through it when they're stressed. So that's really, really, again, that's where we can identify that there's an issue, but the practitioners really got to help jump on board with us so that we can really treat that patient and get good results. And then
sometimes,
go ahead.
So sometimes they can go, like you can have a patient that maybe is going through insomnia, is going through fatigue, or even constipation, or you're trying to help them detox and the detox is not working, or there is that, as I mentioned, the imbalance, the hormonal imbalances. Then maybe it is time, if you have done everything, maybe it is time to check what's going on in the mouth, because the mouth can be causing a lot of chronic stress in the body. It can, even if there is an infection, if there is toxicity in the mouth by having heavy metals, like a lot of mercury fillings, for example, or even infections on a root canal tooth, or periodontal infections, then it can elevate the cortisol levels, increase problems with blood pressure, then it's going to impair even the glucose handling, and then is going to definitely disrupt the sleep and the adrenal fatigue. So it's really important to see if you have done everything with your patient and the patient is not improving. So let's look at that lens in the mouth and what is going on in there.
Yeah. And I would say, it's actually also just a good place to start. I mean, if you're trying to be super comprehensive, like I said, most people have had cavities. Most people have. So if you're not asking your patients about their dental history, have they had deep cleanings? Have they had bone loss around their teeth? Have they had any periodontal issues? Have they had cavities? Those are great questions to actually add on to the medical history form, because that tells you if you suspect that there could be either some infection or that dysbiosis in the mouth that is then going to be affecting, the rest of the body. That's going to make your treatment much, much more successful. And so if you have a cavity, there are certain things that we can do to help remineralize things. We have a peptide treatment that we actually put on the tooth, and it can remineralize smaller cavities, which is super exciting and amazing. Once we start drilling on a tooth, we can never put that tooth back. So we like to be as minimally invasive as possible. Every time we put a filling in a tooth, there's going to be a seam between the filling and the tooth. And over time, no matter how good of a dentist you are, that seam is going to break down. And so eventually all fillings will need to be replaced. And so anytime that we touch the tooth, we don't take that lightly, because we know we're really setting that tooth up for basically being married to the dentist for life, right? So we really try to be minimally invasive, but sometimes we do have to drill. Sometimes there's a big cavity and we've got to get in there and drill. If we let the cavity go too long, then that tooth can become infected and the nerve of the tooth can actually die, and that can cause a big abscess. And those abscesses are not fun. They are painful. They really can affect your systemic health. They make patients exhausted. You have to remember, the teeth are only about 2 inches away from the brain. So if we've got this huge infection in our head, that's not going to be good. It's not good. People feel way, way better when those infections get removed from their body. So that's why we want to treat cavities really, really early, and we want to be the most minimally invasive as we can. And sometimes, like 50% of dentists, maybe it's a little less now, but about 50% of dentists are still using mercury fillings to put in as a filling material. This to me is insane. It's insane to me that I can literally take mercury, it's 50% by weight mercury, and I can either put it in your head, but I cannot put it in the garbage, but I can put it in your head. Okay. And just so you know, as a practitioner listening to this, because I've gotten this back from patients a couple times where they're like, well, my doctor doesn't think that I need to have these out unless they're really bothering me. So let's just talk about mercury fillings for a second, because I think this is super important for every practitioner to understand. Mercury fillings, it doesn't matter how old they are off-gassing. Okay. And if you have hot foods, if you're chewing gum, every time you eat, they're off-gassing. Okay. There's a great YouTube video called Smoking Tooth on YouTube. You can put it into just smoking tooth, and they take a 25-year-old mercury filling in an extracted tooth, and they hold it up to a screen that shows mercury vapor. That thing is still, after 25 years, off-gassing, okay? So this is going into your patient's head, and they are swallowing all of the saliva, and all of this mercury is going into their gut, okay? So what is that doing to their gut by swallowing all of this mercury? What is that doing? So we have to think about mercury fillings like, yes, they're in your head. They might not bother you, but do we know what they're doing to the rest of the body? And as a dentist, my answer is, I have no idea. I'm a dentist. I can't promise anybody that if I remove their mercury fillings, that all of their systemic gut issues are going to go away. But as a doctor, you should really understand that, because your patients are probably going to do better when they are not swallowing a ton of mercury all the time, okay? And when we remove these fillings, we're using a very safe protocol. We're all accredited at this office by the IUMT and are doing a SMART protocol, so it's reducing the exposure to the patient. And another really, really interesting study that you should know about is that they did a study with sheep where they placed mercury fillings in the sheep. And 30 days later, they sacrificed the sheep and they did body scans, and they had tagged the mercury so that they could see what mercury was from the fillings. And after just 30 days of these sheep having mercury fillings, the body scans showed that the mercury had accumulated in every single organ in the body. Every organ, the brain, the liver, the heart, it was everywhere. So they came back and said, well, sheep chew a lot more. They're grazing, so that's not really a good study. Okay, so they did it again in monkeys, and they found the exact same thing. So if your patient has had mercury fillings at all, I don't care if they are 5, 10 days old, if they're 5 years old or 25 years old, I don't care. We know that there's probably mercury built up in the body. Now, of course, there's other genetic things that go into that, right? How good is your body at detoxing? Some people have really great genetics for detoxing, and other people have really crappy genetics for detoxing. And I happen to be one of the crappy detoxers. So I've learned the hard way. But we have to look at those patients and understand once those mercury fillings come out, we're not done, right? I'm done as the dentist. But now we're going to pass them off to you as the practitioner. And what are you going to do with them? Right? The other thing is we're going to tell them when they come in to say, I want these mercury fillings out, we're going to say, okay, go to your doctor and let's get you doing some prep work to get those mercury fillings out. And I've had a lot of doctors call me and say, what do you mean I need to do prep work? What does that even mean? And I'm like, well, we are about to remove a ton of toxic stuff from this patient's head. I want their detox pathways open. Okay, I don't want to drill these fillings out and you swallow some of that stuff and then you're not pooping. Like, you got to get that stuff out of your body. We have to make sure that you're pooping and that you're doing lymphatic drainage, and all of those detox pathways need to be open. So when we send a patient to prep for that, we really want to make sure that when we remove this stuff, it goes out of the body and that their system is supported. And again, if they have crappy genetics, that is going to change maybe some of the supplements that you give them. Maybe you want to be more aggressive, right? So that's, again, I'm the dentist, and I'm not legally allowed to do heavy metal detox and all of that stuff. I want that to be your lane. And so, we got to work together. And once those mercury fillings come out, you need to work with them on detoxing, whether you're doing chelation, oral chelation or IV chelation, or, I'm a fan of doing challenge tests so that you can see what's actually going on in the body. But that's huge. And it's if you're doing chelation and your patient still has mercury fillings in their mouth, because I've also gotten these where the patients come in and they've been detoxing for like years and they're not getting fully better and their levels are still kind of high. And I look in their mouth and they've got mercury fillings. And again, I don't care if it's a tiny filling or a big filling, you're getting mercury into the body. So you need to take those out. You cannot fully detox the metal out of someone's body if they're constantly swallowing that mercury and breathing all of the mercury vapors in. That's not going to work. You have to take, if you have a swimming pool and you have little kids peeing in it, you can't just take the kids out and be like, okay, the pool's clean now. No, we have to take the kids out and clean the pool water together, right? So this is where we really, really depend on our doctors that we work with to really make sure that we are treating these patients comprehensively and not just removing, but finishing the whole loop there.
Yeah, and just remember that it's not just having the filling in there, but the thing is that we chew, we brush our teeth, we drink hot things, and that makes that the vapor of the mercury is releasing even more. And it can even impair the mitochondria on our cells, the thyroid, and then detox pathways, as Dr. Taylor was talking about. So it is really important to just find out also how are your heavy metals levels, how are those levels, especially mercury levels, because if you have a lot of mercury fillings, we have to be careful removing them. We have to use not only the SMART protocol, but maybe repairing your body and then doing it in phases instead of removing everything at once. Because a lot of patients, they just go, yes, I just got all my fillings removed. Then after that, I feel really sick. Well, how was your level before you remove all these fillings? And then you didn't prepare your body, and now your body is even a higher level of toxicity with this. And then talking about toxicity, we can also talk about metal toxicity, not just the mercury is, because, for example, patients that have titanium implants, those implants, they start shedding particles that they disrupt not only the gum. The gum doesn't like the titanium implants. The gum around those implants are usually red, irritated, they bleed even after years of having the implant in the mouth. The gum doesn't like it. And then it disrupts the flora and it increases an inflammatory response in the area that produces inflammation in the body. So there are some studies that show that titanium-induced inflammation bone loss and immune reactivity in implants is really, really big. So we need to be aware of that. So just maybe asking your patients, do you have any titanium in your mouth? Any implants that are titanium? Do you have any root canals? Do you have mercury? So look in the mouth. When you're looking at the tonsils, when you're looking at their tongue, let's just see what is it that you are finding in the mouth. Because then also we go and there is another reaction that we can have. I had a patient the other day and she had a gold crown on the upper tooth and a mercury filling on the opposing tooth on the lower. And she was saying every time I bite down, I feel like a shooting pain. And then there is this galvanic reaction that happens that is like electrical current that is caused by those different metals in the mouth. So if that's happening, just think about what it's doing with the rest of the mouth, the gum tissue, and then also with the body. Body is responding with an alarm, with inflammation, and is also causing some imbalances in the nervous system.
Mm-hmm. Yeah, there's a ton of proprioception in our mouth, and we talk about this with patients a lot when we talk about dealing with occlusal disorders and bite issues. But the proprioception in our mouth is so sensitive. You know, if you bite on a human hair, you're like, ooh, there's a hair. Like, wow, that's something in my mouth. You know, if you step on a human hair, you don't have that same reaction. And so there's all sorts of signals from the teeth and the bite and the mouth that are going back to the brain and giving us feedback constantly. And so this is why the mouth is such a delicate structure, I would say, to treat. We have to be very careful. But like you said, if you've got a tooth that's got a big infection, or you have this galvanism happening where you've got these different metals and it's creating like a battery-like effect, and you have that in your mouth for years and years and years, like, we got to calm that nervous system down, you know? And so sometimes we'll recommend like prolotherapy or even acupuncture to just kind of help calm the system down. And again, you know, patients might present to you even after dental work is done, and they're like, man, I just still have this lingering pain here. Well, that might be because that nervous system still is activated, and we need to calm that nerve down. So It's it's an interesting phenomenon that happens in the mouth that I think not a lot of people really think about that. So and then if we have, so Dr. Isabel actually does she does the extractions in our office. And so if you have a tooth that has a big cavity, like we were saying before, and that tooth gets infected and the nerve of that tooth dies, then that can create a big abscess. And those abscesses are not good to have in your head. There's all sorts of studies that have linked those to even cardiovascular events. So not good to have those in our head. And it's similar with a root canal tooth. So I've also heard a lot of practitioners that are like, oh yeah, root canal, it's totally fine. And that might be fine. Like, for some people, maybe a root canal is fine. But the idea with a root canal is that, and we have a whole podcast just on root canals, so if you're interested, go listen to it. But if you have a root canal, you know, teeth are porous, right? And so they're like little sponges. So when we do a root canal, we're basically drilling a hole from the top of the tooth down all the way to the nerve. We're removing the nerve tissue. We're putting bleach in there. And then we're basically putting like a filling material and a sealer material in there. So that tooth, it will turn brown, it will turn dark or gray. It's not alive anymore. There's no vitality. There's no stem cells. There's no immune system in that tooth anymore. Okay, we are taxiderming it for function. Okay, where else in the body do we taxidermy organs? If your finger turned black, would we like take out all the blood supply and we'd like shove it full of like filler material, and then we just like leave our black finger on our hand and be like, okay, it's good now. We can at least use our pointer finger now. No, we would remove it. Why? Because we know that we can't remove all that infection. The tooth is dead, right? The finger is dead. It's necrotic tissue, so we would remove it. So that's similar to what root canals are, right? And we don't like losing our teeth. Nobody likes losing their teeth. However, again, every patient's different, but if your body is constantly being bombarded with those bacteria that are left inside that tooth, because there's no way you can clean that tooth because it's like a sponge, then that's going to potentially have an impact on the systemic body. And so when Dr. Boyd Haley did research on root canals, and he found that out of all the root canals he treated, 25% of them had a pretty benign bacteria. So it wasn't causing the immune system to react. Pretty benign, 25%. Then he found that 50% had bacteria in those teeth. And these are teeth that didn't even hurt people. They were just root canals, people that just wanted the root canal teeth out. And he tested found that 50% of the other group had bacteria that would elevate the immune system and did cause an immune reaction. And then the last 25% he found had such toxic bacteria in them, like even more toxic than botulism, that they caused huge issues systemically. So when we look at root canal teeth based on that study that he did, we can say that 25% of root canals in people's heads might be okay. They're benign. But 75% are probably not. That's a huge number. So again, this is where we got to start talking to our patients about, do you have root canals, and have you had a CT scan? Have you evaluated those root canals to see the health of them? Because there's no nerve in these teeth, there's no nerve in a root canal tooth. They don't feel it. They don't feel an infection. And we've seen patients that have walked around for years. I mean, probably 5, even 10 years sometimes with this infection that they didn't even know about.
It is incredible because not every patient, but a big percentage of patients of the extractions that I do, we send that to the lab, to DNA Connections, to evaluate what kind of bacteria we have in those teeth. And I will say, I don't want to say 100, but 90-some percent.
99.9%.
99.9% of the reports that come back. So up to level 9, is considered kind of normal level of amount of bacteria. We are bacteria walking, like we are more bacteria than cells. We have more bacteria than cells in our bodies. But when we look at those reports, when it's above 9, that is a dangerous zone. And none of the reports I've received in 3 years are below 9. None. And the majority are even double that amount. So it's 18 and above of the amount of bacteria. So that means that the amount of bacteria that we have found on those teeth that are extracted that have root canals have really high levels of bacteria that are very aggressive in many cases. And yes, some can be treated with antibiotics, but a lot of them are resistant to antibiotics. So it will be important to understand, okay, does your patient has a root canal? How bad is it? And then what Dr. Taylor said is really important, because a conventional dentist is going to take a PA, which is a radiographic X-ray that is just showing one dimension or 2 dimension of the tooth, and you won't be able to see in those the lesions or the infection that those teeth have. So they need to have a CBCT, a 3D image, to be able to identify the lesion. And as Dr. Taylor said, patients a lot of times don't even have symptoms. But that doesn't mean there is a problem brewing that is taking the energy from the immune system to be working on something else in the body, and is concentrated on that tooth that is having the infection that is supposed to be silent. But if we have the right tools to detect and to diagnose this, we can prevent a lot of problems that are going to be in a systemic condition.
Yeah, and the cool thing too about that report, so once Dr. Isabel removes an infected tooth or even a root canal treated tooth, she'll send that to the lab, like she said, and we get a full report back. And, sometimes we see E. coli on those reports, or we see parasites on those reports. They're literally living in your tooth. And so isn't it helpful as their physician to know what kind of infection was in their mouth? Because we know that's systemic now. We know that is systemic, right? It just takes a couple of minutes for our blood to go from our head to our toes and back again. So for you to get that report and to know, oh my gosh, my patient is dealing with a parasite infection, that really helps you dial in your protocol so that you can treat that more aggressively and you have a more specific treatment plan. So we love working with doctors who want to get our reports, and when we get reports back like this, we send them to the physicians that we're working with, and we really make a point to, just let them know what we found, because it does definitely change up the protocol that you do systemically. The other thing that's very interesting, so we do the same thing with periodontal disease. So periodontal disease is where the bone around the teeth starts to basically get eaten away. And it's actually a host response. So I think this is also very, very important for our practitioners listening, okay? Periodontal disease is bone loss around the teeth, but this is a host modulated response. So the host is attacking itself. It's like an autoimmune condition, okay? Now, the bacteria that are in the mouth may be contributing, right? There are certain types of really, really bad bacteria that are in the gums that are very aggressive. And some of these really aggressive bacteria are linked to, and even have been found to even cause some Alzheimer's disease. But they can affect your blood sugar. They can affect, diabetes, your healing. It also can really have a big impact on heart health. And, the list goes on. Cancers, preterm births, it just keeps going on and on. And again, this is because those bacteria are getting systemic into the body. But some people will have high levels of bacteria and they may have all the systemic risk, but maybe they don't have the bone loss. And so how do we explain that? Well, it's because it's about the host, right? Our body is eating itself, right? So it's those osteoclasts and osteoblasts and all of the enzymes involved in that literally are attacking our own bones, and they're breaking down our collagen. And so we have to figure out with these patients, because some of them actually have certain genetic risk factors, like they have IL-1 or IL-6 genotype. And so we actually do some genetic testing on these patients that have really aggressive periodontal disease to figure out, we call them hyper-responders. Are you a hyper-responder? Or, are you the type of person that gets a mosquito bite and it blows up huge? Or are you the type of person that gets a little mosquito bite and then it just barely itches and it goes away the next day, right? There's different kinds of people. Same mosquito. So same thing in periodontal disease. Not everybody is the same and not everybody's going to react to that bacteria. But we know that if we see bad bacteria in the mouth, we know regardless of the bone loss, we know that that is linked to other systemic issues. And I have seen 4-year-olds in my office that have parasites in their mouth. 4-year-olds. I have seen 4-year-olds that have spirochetes, which are the ones that dig into the brain and can cause Alzheimer's disease. So we have to test, again, that oral microbiome is so, so important, because every time that we're brushing or we're flossing, if we get any kind of blood, when we're flossing or brushing, that's all of those microbes are getting systemic in the body. And so that's really, really important to look at, because, again, if you have a 4-year-old that's got a parasite in their mouth or a bunch of spirochete bacteria that are really going to be causing other issues in the heart and the brain, we want to get rid of those, now. And then we also, again, have to think about the gut. How are those bacteria doing? Are they getting into the gut, right? We can clean this up, but we got to clean this up too. And so when it comes to our periodontal patients, we really want to work with our practitioners closely to, again, address that gut microbiome. We got to get that gut sealed. And periodontal disease is kind of like the equivalent of leaky gut, but it's leaky gums. Okay, so again, think of leaky gut and those tight junctions. This is leaky gums. Okay, so same thing is happening in the gums. All of that bacteria is getting into the body. So we want to treat periodontal disease aggressively. If somebody comes in, even if they don't have bone loss, or if their gums don't look super red, if I see bad stuff on their slide, I want to get rid of that. We have to fix the microbiome. And then if we have really aggressive periodontal disease, we also need to look at deficiencies, because sometimes people have super low vitamin D levels. They have super low magnesium. Their B vitamins are hurting. So we've got to look systemically at other things, because even hormones like thyroid, all of those things can actually contribute to our periodontal risk factors. And so this is, again, where we are going to ask our doctors that we're working with, hey, please do all of this blood work for us, and let's get those things dialed in so that patient, when they come back and we do our treatment, they're going to heal better. We want them healing better. We want them responding to our treatment the best. And we've got to make sure that they have the building blocks so that they can regenerate the bone and build the bone and not lose any more bone. Okay, so got to make sure they have good minerals and all of those, similar to kind of cavities, right? All of those happy bone things like magnesium and fat-soluble vitamins, vitamin C, all of those are super, super important when it comes to both cavities and periodontal disease. And then really looking at the host response as well, and trying to halter and put on pause that host response so that we can build the bone back around some of these teeth.
Another important part of it is the cholesterol and triglyceride levels, especially I notice the difference when I'm doing surgery, because we do PRF, which is plasma-rich fibrine. So we draw blood from the patient, and then we spin it in the centrifuge. So that separates the red blood cells from the rest, and then we get a fibrin plug, basically. But then when the patients have high cholesterol, triglycerides, the quality of the PRF is really, really low. So instead of getting that nice plug that rich in fibrin, it's more liquidy and more runny. So having that vitamin D, checking the triglycerides, cholesterol, and then taking all the vitamins that Dr. Taylor mentioned will be a really important part of the healing process in the mouth.
Yeah, and I would mention too, lymphatic drainage is also huge when it comes to dental infections that we're trying to deal with. So anything that can help get the lymphatic system moving, whether it's dry brushing or vibration plate or even, manual lymph massage is awesome to help with that. So if you do that with your patients, that's awesome. But we always, recommend that as well. And then the last disease, like we kind of mentioned, and could be a whole new podcast on its own, is just that bite disorder disease, so occlusal disorders. And in this case, a lot of times people that have bite issues, there's a lot of neurological stuff that's going on. They might be having headaches, migraines, neck pain. They could have tingling in their fingertips. They could have even tinnitus can be linked to TMJ issues. The list kind of goes on and on. And so, a lot of times patients have had orthodontic treatment where they're just putting the teeth wherever they need to go so that the bite comes together, but we're not really thinking about where are the muscles, where are the nerves, where is the jaw joint. And so again, because the system is so sensitive, when we are just moving teeth blindly, we're not really paying attention to the rest of the system. And so because our teeth have to come together to eat our food, our teeth are always going to win in this situation. So oftentimes, everything else around our teeth has to compromise. And so what happens is our muscles end up being super fatigued. We have dysfunction in our muscles. It might pinch a nerve somewhere because our teeth are shoving our jaw joint into a certain position, and that all can cause symptoms. So when we're dealing with bite issues, cranial work is super, super important. There's tons of cranial strain in patients. So every time that they bite on their teeth, if there's a bite imbalance, let's say that they're biting more on their right side, or they're only biting on the right side. Every time they do that, this is what's happening to their cranium. It's getting torqued. There's all this torque that's happening in their head. And we're chewing, we're swallowing, our teeth are coming together probably 1,000 times a day. And every single time that they come together, that's causing that cranial torque. So we have to balance the bite, but we also have to help unwind these patients because they have been so wound up for so long. And finally, this is the straw that's breaking the camel's back. So it's super important that we are gentle with them. It's super important that we're not overly aggressive. We want to make sure that we are helping them unwind. And there are several different types of chiropractic techniques and cranial techniques. And I've worked with a lot of patients with a lot of different kinds of different techniques. What I have found to be the most successful are the ones that are more cranial heavy focused and the ones that are not aggressive. Okay, when you start to adjust the jaw, I've seen this in so many patients, they don't get better because there's nothing that you can do to the jaw that will make the bite different, okay? You're going to force the muscles to be a certain way. Well, guess what? The teeth have to come together to eat food. So you're just going to be forcing them back. They're going to have to force themselves back into that position, and that's going to create a ton more cranial strain. So my ask of practitioners is please don't touch the jaw. If you have a patient that has TMJ issues, you have to evaluate their bite and see if it's creating cranial torque. And, you can put this muscle or this joint in the right position, but if that doesn't jibe with the bite, then it's not going to stay. So, and then it's going to go back to its old position. And sometimes that inflammation from just that adjusting, because everything is so tight and inflamed, can cause more symptoms. So you got to be very careful when you're dealing with bite issues. It's super, super important. We can feel 1/10 of a millimeter. That's how much we can feel between our teeth. So that is literally that's what we're dealing with when we're trying to balance a bite is 1/10 of a millimeter. You can feel a difference from. So
it is incredible. And that's not even mentioning all the emotional connections that patients have when there is a condition. Just going back to the meridians and the connection with the organs, there is also a connection with conflicts and emotions. And then when we're talking about that occlusion disease, there is even more connection with emotions as well. So that's something to think about when you're treating a patient. Maybe there is some new sensation of being more anxious or maybe having some more depression. So what's going on? Let's just look at all the pieces of the puzzle to find out the root cause of this patient's symptoms.
Mm-hmm. Yeah, it's really amazing. And Dr. Isabel does a lot of the emotion work. So if that's kind of a new territory for you and you're not sure you want to dive into the emotion stuff, Dr. Isabel loves the emotion stuff and would love to work with clients as well, so, or patients.
Yeah, my patients cry not because I'm hurting them, but because they find that there is a huge connection of what's going on in their life at the emotional level with their teeth.
Yes, I would say I think probably at least once a day we have somebody crying in the dental office. It's just, I think that there is so much trauma around dentistry and so much trauma around just in life.
In life.
It's just incredible how much trauma there is. And a lot of it really comes out when we start to deal with the mouth. I just think, the mouth is such an interesting place because we speak our truth with our mouth. We express ourselves with our smiling, our different types of expressions that we have. We can tell somebody if we're angry or if we're happy or if we're bored. You can tell that from the way that your mouth looks, and then we also look at teeth, right? Teeth, they say, are one of the first things that we see. Like when you're on a date with somebody, you notice their teeth first. So it's a really important place. And when there's disease there or when there's dysfunction there, then that can trigger all sorts of things, right? That all these things can kind of come up. And so we definitely see that a lot in our office.
Yes.
Awesome. Well, did we cover it all, Isabel?
I think so. And so just kind of to summarize, and for doctors, maybe to start asking more questions about what's going on in the patient's mouth. Do you have root canals? Do you have any mercury fillings or any metal filling or restorations, any metal implants, titanium implants? Maybe have you had any history of extractions or jaw pain or any gum disease, any bleeding? Because a lot of the times patients don't know if they have gum disease, but they know if their gums bleed. And there is a topic that we didn't cover today, but there is a podcast about it, and it is the cavitations, because that's a big part also of systemic inflammation. And so maybe when you ask about have you had any extractions and you see a patient that maybe is having Lyme disease and they have flare-ups, maybe there is a connection with the systemic response that there is a need to look in the mouth. Or if you've treated a patient and the patient is not improving, maybe that's a sign that you need to go and look at the mouth, and maybe send it to a trusted biological dentist in the area that can evaluate that.
Yeah, I think, listening to this, I would say most dentists, unless they have been trained in biological dentistry, a lot of this is over their head, unfortunately. They might do a little saliva testing for periodontal disease, but most dentists are telling patients, like, you need to brush and you need to floss, and that's why you're getting cavities, and, they're doing deep cleanings and pushing all the bacteria just more into the body systemically. So you really do need to find a good biological dentist. And we actually did another podcast on this, questions that you need to ask your biological dentist so that you can screen them to know, because there's really a big variety of the amount of training that biological dentists have gone through. Some of them have gone to a weekend course and they're biological now, and others have gone through years of extensive training, like myself and Dr. Isabel. So there's not really great standardization, I would say, in the field. There is no dental schools that teach this type of stuff. You have to go through tons of courses to get all of this knowledge, and it's not in one place, right? It's all over the place. So you have to be super motivated as a practitioner to really get educated. So, but the IAOMT and the Biological Dental Association websites are good places to start. And, if you are local to us and you want to work with our office, we love working with practitioners. I wish there was more of you around. And we will send, when we see patients, as new patients, we are sending letters to our practitioners with our findings. And anytime we're getting a radiology report or we're doing salivary diagnostics or anything like that, you're getting a copy of that too with our recommendations. So we love keeping the door open. We love working together with practitioners. And if you want to learn more, we would love to come meet with you for lunch or even set up a Zoom call so we can learn more about your practice, more about what you do. And yeah, just so that we can serve our community better.
And the thing is that, so your herbal protocols, the detox plans that you're doing, or that endocrine support will go only as far as the mouth is more balanced and stable, instead of being infected or imbalanced and contributing to all these symptoms that your patient is having. So together we can move the patients from survival to health and regeneration.
Yes, and I just going to throw this one more thing out there because this is a pet peeve of mine. So sorry if you've done this and I'm offending you, but if a patient has an abscess, you cannot put just garlic on it and make it better, okay? I can't tell you how many patients have come in and they're like, well, my doctor thinks I can just put some garlic on it, or I just need to put like a pack of something, or my herbalist is telling me to take this herb. Like, your tooth is dead. Your tooth is dead. I've never seen a dead tooth come back to life, ever, never. Would I want that? Yes, absolutely. I never want to be aggressive if I don't have to be. I want to be so minimally invasive. But like, if you are just telling patients that have true infections to just put some ozone on it or put some garlic on it, whether it's periodontal disease or an infected abscess tooth or a root canal, like, yes, you can help their body a little bit. Like, you can help facilitate the immune system. You can give the immune system some support and all of that. But that infection is in their head. And until you remove the infection, you have to remove the infection, just like the mercury fillings. You can give them all sorts of binders. That's great. But you have to remove the source of the infection. And then their body can actually heal. Because when you leave infection in the body, that is not good. We don't want to do that, okay? And I've just seen so many patients. There's been so many patients that end up not taking out their infected teeth because their practitioner has thought that they can give them some herbs or this protocol that they do to fix it. That's not how it works in the mouth. That's not what we're dealing with. We're literally dealing with a dead organ. You cannot clear that up with herbs. Even antibiotics, yes, the swelling will go down temporarily. Then guess what? It will come back. Every time it will come back. So we got to work as a team and we got to trust each other.
And then in the meantime, so you might see that it improves at the surface. Oh, the gum is not as swollen, the pain is better. But then at the inside, there is more bone being resorbed, more bone being eaten away by the bacteria, creating a bigger problem. And now you just don't have a little infection, you have a big infection.
Yeah. And even if that infection doesn't get bigger, you still have a huge infection, and that's all getting systemic in the body. So
correct.
It's just much better if we can work together, if you can let us do our diagnostics. You know, we have tools that you don't have, right? You have tools that we don't have. And so I don't want to be the expert in the gut health and all this stuff. The detox, that's not my lane. I want to know about it. I want to refer to you for that. I also want us to be able to use our diagnostic tools and our brains and work with you together so that we can come up with a protocol that best serves the patient. So if you are listening to this and you are a patient, send this to your doctor so they can listen to it, especially if some of these things came up and you're like, does my doctor know about this? Send it to them. We are really trying to educate our doctors in our area so that they can work with dentists. We need that collaboration, and it's so missing right now in healthcare. So send this to your doctors. If you're a practitioner and you're listening to this and you want to learn more, then let us know. We would love to hear from you. We would love to meet with you. We would love to come have lunch with you. We'd love to do a Zoom call with you. We want to support you, and we want this to be a great, great relationship. So please reach out to us. We love the collaboration. So, and if you're a listener and you love this podcast, make sure that you like it and leave us a good review and tell all your friends, because I think we have a great podcast and we have all this amazing information and I want to get it out to the rest of the world.
And I want to throw in something in there, because I met with a group of naturopaths and they didn't know that we could see the bacteria in the mouth. So if you're a naturopath and you're interested to see what kind of bacteria there is in your mouth, I will be willing to take a look, get a sample of your plaque, your dental plaque, put it under the microscope, and together we can look at the type of bacteria you you have, and then you can see what we're able to see and how we can determine that our patient is at risk of periodontal disease or even systemic conditions.
Yes, I love the microscope. It's super fun. It's very motivating. Yeah, come in, we'll do a slide on you, but just reach out. So anyways, well, everybody, thank you so much. Dr. Isabel, thank you so much for taking time out today to deep dive into this. This was a long podcast because we had so much to talk about, but it's all super, super good information. So like I said before, make sure that you like us on social media. We are Green City Dental, and we also have a clinic, Ochoodontics, that focuses on TMJ, airway health, and functional orthodontics. So until next time, remember, your mouth matters. Thanks so much for tuning in to Your Mouth Matters. If you enjoyed this episode, please take a moment to leave a review. It helps more people find the show and join us on this journey towards whole body health, starting with the mouth. Make sure to subscribe so you never miss an episode. And if you found this helpful, share it with a friend or two, especially the ones who nerd out on wellness as much as we do. You can also follow us on social media at Green City Dental and Ochoodontics for updates, resources, and behind-the-scenes conversations. Until next time, breathe well, smile often, and remember, your mouth really does matter.